to the withdrawal response seen earlier. Stimulation near the mouth now evokes a turning toward the stimulus and an opening of the mouth. This response is called the rooting reflex, and it persists after birth, helping the newborn find his or her mother's nipple during breastfeeding. The face continues to mature as fat deposits begin to fill out the cheeks and tooth development begins. By 15 weeks, blood-forming stem cells arrive and multiply in the bone marrow. Most blood cell formation will occur here. Although movement begins in the 6-week embryo, a pregnant woman first senses fetal movement between 14 and 18 weeks. Traditionally, this event has been called quickening. By 16 weeks, procedures involving the insertion of a needle into the abdomen of the fetus trigger a hormonal stress response, releasing noradrenaline or norepinephrine into the bloodstream. In the respiratory system, the bronchial tree is now nearly complete. A protective white substance, called vernix caseosa, now covers the fetus. Vernix protects the skin from the irritating effects of amniotic fluid. From 19 weeks, fetal movement, breathing activity, and heart rate begin to follow daily cycles called circadian rhythms. By 20 weeks, the cochlea, which is the organ of hearing, has reached adult size within the fully developed inner ear. From now on, the fetus will respond to a growing range of sounds. Hair begins to grow on the scalp. All skin layers and structures are present, including hair follicles and glands. By 21 to 22 weeks after fertilization, the lungs gain some ability to breathe air. This is considered the age of viability, because survival outside the womb becomes possible for some fetuses. By 24 weeks, the eyelids reopen, and the fetus exhibits a blink-startle response. This reaction to sudden, loud noises typically develops earlier in the female fetus. Several investigators report exposure to loud noise may adversely affect fetal health. Immediate consequences include prolonged increased heart rate, excessive fetal swallowing, and abrupt behavioral changes. Possible long-term consequences include hearing loss. The fetal respiratory rate can rise as high as 44 inhalation-exhalation cycles per minute. During the third trimester of pregnancy, rapid brain growth consumes more than 50% of the energy used by the fetus. Brain weight increases between 400 and 500%. By 26 weeks, the eyes produce tears. The pupils respond to light as early as 27 weeks. This response regulates the amount of light reaching the retina throughout life. All components required for a functioning sense of smell are operational. Studies of premature babies reveal the ability to detect odours as early as 26 weeks after fertilisation. Placing a sweet substance in the amniotic fluid increases the rate of fetal swallowing. In contrast, decreased fetal swallowing follows the introduction of a bitter substance. Altered facial expressions often follow. Through a series of step-like leg motions similar to walking, the fetus performs somersaults. The fetus appears less wrinkled as additional fat deposits form beneath the skin. Fat plays a vital role in maintaining body temperature and storing energy after birth. By 28 weeks, the fetus can distinguish between high and low-pitched sounds. By 30 weeks, breathing movements are more common and occur 30 to 40% of the time in an average fetus. During the last 4 months of pregnancy, the fetus displays periods of coordinated activity, punctuated by periods of rest. These behavioural states reflect the ever-increasing complexity of the central nervous system. By approximately 32 weeks, true alveoli, or air pocket cells, begin developing in the lungs. They will continue to form until 8 years after birth. At 35 weeks, the fetus has a firm hand grasp. Fetal exposure to various substances appears to affect flavour preferences after birth. For instance, fetuses whose mothers consumed anise, a substance which gives licorice its taste, showed a preference for anise after birth. Newborns without fetal exposure disliked anise. The fetus initiates labour by releasing large amounts of a hormone called estrogen, and thus begins the transition from fetus to newborn. Labour is marked by powerful contractions of the uterus, resulting in childbirth. From fertilisation to birth and beyond, human development is dynamic, continuous and complex. New discoveries about this fascinating process increasingly show the vital impact of fetal development on lifelong health. As our understanding of early human development advances, so too will our ability to enhance health both before and after birth.